Welcome back, everyone, to another deep dive. We've got a really important topic for healthcare providers out there, especially for you medical residents. We're going to be diving into frailty and how it affects cardiovascular health. You sent us some really great sources for this deep dive. Scientific articles, systematic reviews, and even an audio blog from patients themselves.
Yeah, I think this one's really going to resonate. It's a topic that deserves a lot more attention because a lot of people think frailty is just what happens when you get older, but it's really not. Frailty is actually a very specific state of vulnerability. It's like your body's reserve tank is running low. That makes it harder to bounce back from stressors, like if you get sick or if you have an injury.
Kind of like having a smaller gas tank. You can't go as far, and those unexpected detours, they really hit you hard. So how do we spot this in our patients? I see we've got effective non-pharmacological interventions in your progenital. People with cognitive frailty review. BMC Pub Health, 2024, 1288920-274, Article 2007-9.PTF EGFD.
Yeah, this one talks about the fried phenotype. That's what a lot of people are familiar with. It looks at things like unintentional weight loss, muscle weakness, exhaustion, slowness when you move around, and how physically active you are.
Okay, so if our patient has 3 or more of these things, that's when we know, that's a red flag.
Wow.
I'm also seeing a few other sources here about different ways to measure frailty. We've got factors associated with frailty in older people, an umbrella review, BMC Geriatric 2024, 12877-2024, Article 52888, WTDF, and multidimensional frailty as the predictor of mortality among older adults. A systematic review and meta-analysis, BMC Geriatric 2024, 12877-2024, Article 5377, BDF,
So are these just different ways of measuring the same thing?
Well, not exactly. The fried phenotype, that's a good place to start, but that one's really focused on physical frailty. There's another tool called the Deficit Accumulation Index. Sometimes it's also called the Frailty Index, and this one takes a much wider view.
Interesting.
It looks at all sorts of health deficits a patient might have, not just physical ones.
So it's like a more complete picture of how vulnerable someone is. Exactly. And then there's also the clinical frailty scale, which is interesting. This one uses categories that go from very fit all the way to terminally ill. It can give you a quick idea of how well your patient is functioning overall.
Okay, that's a wide range. I see you've also got frailty and cardiovascular health. JHA 2024, James et al. 2024, frailty and cardiovascular health.pdf. Is that where we start to see the connection to heart health?
Yes. This source is super important because it really highlights why understanding frailty is so critical, especially when we're talking about cardiology. Frailty actually increases the risk of all sorts of cardiovascular problems, from coronary heart disease to heart failure, even stroke.
Wow, so it's not just about falls or fractures. Frailty is a serious cardiovascular risk factor.
Absolutely. And the relationship goes both ways, which makes it even more important to understand. Frailty can definitely make existing heart conditions worse. But on the flip side, having heart problems can actually speed up the progression of frailty, so it's like a vicious cycle.
Okay, so that's something to keep in mind. So how do we start untangling all of this? What can clinicians actually do with this information?
Well, that's where those other assessments for frailty come in really handy. For example, you've got the Frail scale. It uses 5 things to quickly assess if a patient is at risk for frailty: fatigue resistance ambulation illnesses and weight loss.
So it spells out FRAIL. That's pretty clever. I could definitely see how that would be helpful in a busy clinic. But okay, let's say we've identified a patient as frail. What do we actually do with that information, especially when it comes to their heart health?
Great question. That's a question we're going to dive into even deeper because we'll be exploring how frailty can actually change the way we make decisions about treatments for common heart conditions, like atrial fibrillation and heart failure. Okay, so you're seeing patients and you figured out this person is frail. What do you do next? How do you use that information to actually give them better cardiovascular care?
That's what I want to know. That's the big question, right?
Yeah.
You mentioned that source before, Frailty and Cardiovascular Health, JAHA 2024. Does that one give us some ideas?
It does. It really points out that frailty should change how we think about treatments, especially for some of the more common heart problems, like atrial fibrillation or heart failure.
Let's start with atrial fibrillation then. We see that all the time in older patients. How does frailty change how we approach it?
Well, think about how we usually manage atrial fibrillation. We often use blood thinners to try and prevent a stroke. But here's the thing, frail patients have a much higher risk of falling. And if they're on blood thinners, a fall can be really dangerous.
Yeah, because of the bleeding risk. So you have to balance the chance of preventing a stroke with the chance of them getting hurt in a fall. It's not easy.
It's a tough decision. And it's not the only thing to consider. Sometimes frail patients have trouble managing their medications.
Oh, right.
Maybe they have some cognitive issues, so they might miss doses or make mistakes with their meds.
So it's not just about picking the right treatment. We also have to think about if they can even follow the treatment plan because of their frailty.
Exactly. Then there's heart failure, which can be a whole other challenge.
Right, because frailty makes it harder to manage heart failure, doesn't it?
Yeah, it really does.
I think that Frailty and Cardiovascular Health, JHA 2024 paper, mentioned that, didn't it? That it makes hospitalization more likely, and even death in people with heart failure.
That's right. It also means we have to be careful with some of the medications we typically use for heart failure, like beta blockers.
I wouldn't have thought about that.
They can actually make fatigue and slowness worse in frail patients.
So maybe not the best choice for everyone. What about things we can do that aren't medication, like lifestyle changes?
That's where those lifestyle changes we were talking about earlier can make a real difference. Remember that paper about the factors associated with frailty? It talked about the Mediterranean diet.
Oh yeah, that's the one with all the antioxidants and the foods that fight inflammation. Could that help protect someone from both frailty and heart problems?
That's what the studies seem to show. And then there's exercise. But it's got to be the right kind of exercise.
What kind are we thinking about here?
Strength training. If you can build up muscle strength, it can really improve how well someone functions physically and how independent they are, especially if they're frail.
So just encouraging them to lift weights or do some body weight exercises could make a big difference, not just for their heart, but for their whole life.
It really can. And we can't forget about mental health and substance use.
Right, that was in that same paper too.
If you can address those things, it can make a patient much more resilient. They can bounce back better from the things that can lead to frailty.
It's a lot to consider, isn't it? Diet, exercise, mental health. How do we even begin to deal with all of this when we're in a busy clinic?
Yeah, that's the real challenge. How do you actually integrate frailty into your everyday practice? It's something we definitely need to figure out. And that's what we're going to keep talking about as we continue this deep dive.
Okay, so we know that frailty is a big deal when it comes to heart health. And it's something that we need to be looking for in our patients. But how do we make this happen in real life? Clinics are busy, you've got a million things going on. Where do you even start?
Well, the first thing is to change how you think about frailty. You have to start thinking about it like it's a vital sign.
So like taking their blood pressure
Yeah.
or checking their pulse.
Exactly. Just like those routine checks, checking for frailty needs to be a standard part of how you examine every patient, especially if they're older.
I like that idea. But practically speaking, how do we actually make time for this?
It's easier than you think. You're already asking them about their medical history, right? You're asking about their medications. You can just slip in a couple of questions from the Fried phenotype or the Frail scale.
So just casually asking something like, have you lost any weight without trying recently? Or do you ever have trouble going up the stairs?
Exactly. It's just part of the conversation. And it doesn't have to be the doctor who does this. Nurses, pharmacists, medical assistants, anyone on the healthcare team can be trained to do this.
Okay, so that makes it seem a little less overwhelming. So what happens when you do find someone who is frail? What's next?
Well, remember that paper we talked about earlier, Effective Non-Pharmacological Interventions? That paper really stressed how important it is to tailor your interventions to the individual patient.
Right, because what works for one person might not work for someone else.
It's not one size fits all. You have to really think about each patient's specific situation, their other medical problems, what their lifestyle is like, what kind of support system they have.
So for some people, maybe it's all about diet, getting them started on a Mediterranean diet. For others, maybe it's connecting them with a physical therapist so they can start a strength training program.
Exactly. And sometimes it could be something as simple as telling them about an exercise class in their neighborhood or a support group. The most important thing is to be thinking about their frailty when you're making any decisions about their treatment.
That makes a lot of sense. So you're not just treating their heart failure, you're also treating the frailty that's making their heart failure worse.
That's it. You're treating the whole patient, not just one part of them.
Well, I've learned a lot today. This has been a really interesting deep dive. We've talked about how frailty is a lot more than just getting older. It's a serious medical condition, and it can have a big impact on your heart health. But the good news is there are things we can do about it. We can identify it early, and we can do things to help our patients. And that can make a real difference in how long and how well they live.
I agree. It's all about integrating frailty assessments into what we already do every day, and then taking what we find and creating a plan that's tailored to each individual patient.
That's great advice. Thanks for joining us for this deep dive. If you want to learn more, we've got links to all the sources we talked about in the description. Until next time, keep learning, and we'll see you on the next deep dive.